I'm here at ASH 2017 talking about the role of Venetoclax in translocation 1114 multiple myeloma. Venetoclax was originally studied in a phase 1 study in multiple myeloma and found to have an approximately 20% response rate. In the subset of patients who had the 1114 translocation, the response rate was 40%. And so then we, in collaboration with AbbVie, the sponsor of the study, designed a expanded cohort. And the expanded cohort was just the 1114 patient population. And in addition, our laboratory has shown that by adding dexamethasone increases BIM and makes patients more sensitive to Venetoclax. And so we did an expanded cohort phase 1 study, and we had 20 patients treating with Venetoclax. We started at 800 milligrams a day with weekly dexamethasone, 40 milligrams once a week, and 800 milligrams of Venetoclax daily. And what we found was that this was also a safe and well-tolerated regimen. There was no clinical tumor lysis. A few patients had laboratory-based tumor lysis that was managed by dose holding and then reintroduction without any clinical tumor lysis. And what we found was there was a 65% response rate, which is increased from the 40% response rate that we saw with the original study, and now there's a 65% response rate. This was effective across all cytogenetic abnormalities that are in addition to 1114, as well as effective across all prognostic categories, ISS stage, prior lines of therapy. Again, these patients had had multiple prior lines of therapy, and in fact, almost 50% of the patients had greater than 4 prior lines of therapy. And so we're excited about this combination and looking at using cytogenetics as a predictive marker for treatment with Venetoclax and dexamethasone, and we'll be moving to an expanded cohort.